Hello, and thank you for joining us. I'm Sandy Potter, along with Masonicare President and CEO, JP Venoit, and Dr. Ronald Schwartz, our Senior Director for Continuum Health Services. We're checking in with you once again as we all stand together to help prevent the spread of coronavirus. Dr. Schwartz, we're breathing a sigh of relief that vaccines are near, but there are many who are leery about the speed at which the vaccines were made. Can you talk about the safety of the vaccines and what side effects are you hearing about?
Absolutely, Sandy. Well, this is a very big week for vaccines for the coronavirus. And some of you who've been watching the news know yesterday in the United Kingdom, they actually started giving the first vaccinations. And tomorrow, the FDA or a subcommittee of the FDA is going to review the vaccine and actually most likely give approval for emergency use authorization. So to many people, this seems like it's happened at lightning speed. But you know, when you really think about it, at least from my perspective as a doctor, you know, we talked before that the Pfizer vaccine and Moderna vaccine, they both use something called mRNA science technology. And that's something that's been around for many, many, many years. And they've been using research on mRNA science technology, scientists to look at such things as a vaccine for RSV, which stands for respiratory syncytial virus, or the Zika virus. And then when things started to accelerate with the pandemic, all focus was turned to a vaccine for the coronavirus. So even though the technology was really in place, and even though things moved quickly, the studies are very efficient and no corners were cut. The Pfizer vaccine study had 38,000 participants and went through the full phase 3 plan for study, and again is going to be scrutinized by the FDA. So again, I'm confident that there's no corners cut and that it's a very thorough process. As far as side effects, you know, any vaccine has side effects, and those side effects are important, and you expect them because that shows that the body is actually working, that the body is starting to produce antibodies and is working to fight the virus. So you want to see some kind of response, and generally the kind of response they've seen with the vaccines for COVID might be, you know, some soreness is the main thing at the injection site and redness. You might get low-grade fever, some chills, fatigue. And many of you who have taken the flu shot know that you've gotten those symptoms even just by taking the flu shot. So, you know, they're generally minor symptoms, and they're symptoms that are short-lived, but they're important to show that the body is working and responding to this vaccine. The other thing to note is, in addition to the thoroughness of the studies that I've seen, and I've read through, this is a whole manual of more than 50 pages that's here that kind of lists the data from the Pfizer study. And not only is it a very thorough study, and you know, really there are very, very minor side effects that I've seen produced from this vaccine, and most of the side effects that they found were side effects that you might expect just in the normal population of people, regardless of whether or not they got a vaccine. So I think the key thing to remember is that Pfizer vaccine and Moderna vaccine are almost 95% effective. And maybe to ease your minds a little bit, they are not live, they're not injecting a live virus into you. So there isn't that danger. In older days, there were many live viruses. Even the shingles virus vaccine initially was a live virus, and they refined the vaccine. But you don't have to worry about the virus affecting your DNA or having any long-lasting effects. It's a very scientific process, and again, it's been around for many years. And I think that, you know, the final thing that I would say, you know, again, I like to try to think of some inspiration things. And so the other day I took out some Chinese food, and I was just trying to relax a little bit with with everything going on and in the world, you need some time to relax. And I ate my Chinese food and I opened the fortune cookie, and it said, even the longest of days will come to an end. And these long days with COVID will come to an end if we immunize and continue to practice good infection control practices and social distancing and all work together. Thank you.
Thank you, Dr. Schwartz. As always, the perfect words for all of us today. And JP, we're hearing more about the timeline of when vaccines might be available to our residents and staff. What are you thinking at this point?
Well, first, I want to thank Dr. Schwartz for really clearly articulating really much about the virus. And please know that Dr. Schwartz has done an absolutely amazing job at continuing to educate himself and educating everybody else. So, Dr. Schwartz, thank you for all you're doing. From the perspective of Masonicare and when we're expecting the vaccinations, I'll first tell you tomorrow is going to be a very important day for the FDA to really determine whether or not this vaccine should move forward. And next week, the FDA will be also making a decision on the Moderna vaccine. Two vaccines that have shown some significant ability to fight this virus. And we have been contacted by our partner that we should expect to see the vaccine for our staff and our nursing home residents the end of December. So we are expecting that to happen relatively soon. And I will tell you that we're expecting this process probably to be about 6 months from our nursing home residents and our healthcare workers to all the way through our independent living residents. So we are expecting the process to continue through many months. But I do want to draw your attention to the flag behind Dr. Schwartz, because I do want to thank all the staff for everything that they're doing. I know this has been an extremely trying time, but they've done an absolutely fantastic job helping combat this virus. And to all of our residents, patients, and clients that we service every single day, we're there for you. We're doing everything we can to keep you safe. The spread of the virus continues in the state of Connecticut. Yesterday, we saw some pretty significant numbers in the spread of the coronavirus. And we need everybody's help. We need everyone's help. Even with the vaccine, when it comes out and it's being administered, we still need to wear our masks. We still need to be socially distancing. We still need to be vigilant in what we do each and every day, because the vaccine is going to take quite a long time to be administered to the majority of people of Connecticut and the people of the United States. So we need to stay vigilant even when the vaccine is out. And I know we can do it. I know our staff are doing everything they can and will continue to do everything they can. And to our residents, patients, and clients, it's truly amazing that we have the ability to continue to service all of you and make sure that you are safe. And the vaccine will be a step in providing that safety mechanism that will allow us to continue to service you in years to come.
Great reminders, JP, and I know we will all stand together and continue to be Masonicare strong, as you say, through the rest of this and until we get everyone doing well. Well, thank you both so much for sharing your time and all of this important information with us today. And thank you for watching at home. We hope you'll all stay safe and stay well.
Thank you.